Today is World Haemophilia Day. As a medical professional, could you provide the audience with an understanding of what hemophilia is?
Yes, today is a very important day. It reminds us the birthday of Frank Schnabel, who was one of the founders of the World Federation of Hemophilia. That was, in a way, trying to support patients with this congenital disease. It is a disease that is due to a genetic defect of a gene that is the base of a coagulation factor that is called factor 8. And these patients are bleeding because of a very small trauma, or they are bleeding spontaneously. And they are bleeding particularly in the joints and in the muscles. But they can bleed wherever. They can bleed in the brain. They can bleed in the gastrointestinal tract. They can have blood in the urine. So it is really a very severe condition. In addition, the bleeding in a joint or in a muscle is extremely painful. And if it is not prevented or at least treated timely, it can cause a crippling handicap. So the patient cannot any longer walk, cannot any longer just bend an elbow, so he cannot eat, and so on and so forth. So it's a terrible disease that till 50 years ago had practically no treatment.
Mm-hmm. And what kind of treatments has Kedrion developed for hemophilia, and how do these treatments improve quality of life for patients?
So, Kedrion is providing since 50 years ago, indeed, a plasma-derived factor 8 concentrate. So the patient is missing factor 8. There are other form of hemophilia that you can miss other coagulation factor like factor 9, but many other factors that are involved in the coagulation system can be genetically missing. Anyhow, Kedrion is providing this factor 8 and factor 9 concentrates that goes to replace the missing factor. So the patient has got the same level of factor as any other individual. Mm-hmm. Unfortunately, factor 8 doesn't last longer in the blood. So once that it is injected after 48 hours, it disappears. So for this reason, the patients have to inject themselves factor 8 every other day or every 3 days, and in order to prevent whoever bleed, the patient has to inject himself almost forever.
Mm-hmm. And what can we expect from Kedrion for hemophilia patients in the future?
I mean, I would say in general there are a continuous improvement of product, of factor 8 products, and even there are some other innovative treatments that can provide to the patient a better quality of life. What we can expect in the future is really to be able to personalize really in a very perfect way this treatment to the patient. So, in other words, to provide exactly that amount of factor 8 or factor 9, patients with hemophilia B, that they need in order to have a completely normal life. So the same expectation of any other children or men in order that they can have really a very successful life and satisfactory life.
Mm-hmm. Thank you, Professor. And there is a topic we cannot avoid, that is the ongoing COVID-19 outbreak. Have you witnessed difficulties in patients' ability to access the treatments, or is there something companies can do to help treatments reach the patients that need them?
In effect, there is some difficulties. This is particularly due to the fact that patients try to avoid to go to their clinical center in order to be visited or to be regularly checked up because of the risk to get the infection. On the other hand, the lockdown rules, more and more extended all over the world, can prevent patients to access the treatment. So they cannot go to the hospital or to the pharmacy, or they are limited in this movement in order to provide for themselves the treatment that they need. What many companies are doing today is, in effect, to deliver this product directly to the place where the patient is living, in order that it does not risk to go in places where there can be more people, so that means higher risk to get the infection. And what some companies are also trying to do is to have an online visit. So, in fact, not the possibility to visit the patient, to put the hands on the patients, as we are used to say, as doctors, but at least the consultation can be online, like we are having now this interview, and we can exchange with the patient that is more and more now skilled to treat himself and to recognize immediately what are the issues that he's experiencing, in order to avoid to have him in the hospital, but also avoid to leave the patients alone without any medical support.
Mm-hmm. We are very honored to have Kedrion as a member of the innovative biotech ecosystem that we represent. And what will be your message to the other innovators in the biotech community in the area of hemophilia?
So never, I would really ask innovators to never stop to look for a good solution, a better solution even, to treat these patients. And never forget that there is the most frequent coagulation disorder that is called hemophilia A, that is due to defect of factor VIII, as I mentioned before, and hemophilia B, that is a bit rarer, and is due to missing factor IX. But there are other coagulation defects that are not taken enough into consideration. One of these is for sure factor V deficiency, that sometimes is coupled with a factor V and factor VIII deficiency. So, and this defect is can be extremely severe. So my plea to the biotech community is never to stop to look for products that can help patients with coagulation defects. On the other hand, never trade off efficacy for convenience. Sometimes, and it is perfectly understandable, patients, but also their physicians are looking for a solution that can be more comfortable for the patient, but which is absolutely correct. And this is the aim in general of medicine. But we should always consider that efficacy is the priority, safety is the priority, and convenience perhaps if it comes, that is perfectly fine, but we cannot sacrifice safety and efficacy for convenience. This is another, so to say, sort of request to the biotech community, because sometimes we are looking for shortcuts, but shortcuts cannot always be the best solution. So to continue to investigate, to have safer and safer products, not only safer for what is concerning, for example, plasma-derived products, but also for any other biotech product, safety is really probably the first priority. And efficacy, of course. It can be safe, but if it doesn't work, there is no chance.
Thank you very much, Professor.
Thank you.